in Chennai.
Hello, I'm Dr. Janaki. I'm a consultant psychiatrist in Chennai.
Today we are doing the fourth video in our series for Mental Health Awareness Week. And this week we are going to talk about what not to say to a patient with a psychiatric illness. So many times we find that the family members of a patient, or maybe a friend of a patient with symptoms of a psychiatric disorder, will come and tell them, this is not really an illness, it's all in your mind. You need to get over this. You need to think positive. Do some yoga, do some exercise, and you'll feel better. Don't what You don't actually want to get better. You are actually being attention seeking. You are being weak. So by making these statements, we are actually being very judgmental towards a person with a psychiatric disorder, and it may make them feel hurt, that they are not being understood, and may make them want to close up and not open up about their problems to others.
So one of the things that we all, we hear quite a lot nowadays is that people do want to help. They do want to care for people who are having emotional issues, and they do try to reach out. But when they reach out, they may say the kind of things that they feel are actually motivating the patient. But then if there is a person, again, if we compare a physical illness here, if a person is having a fracture, if they have a leg that is fractured, you not tell them that you can get better, you can run, just get up and run, just run the marathon, you'll be all right, you just need to think positive. You won't say things like that, isn't it? So in this case also, you have to think of it as a physical illness, because it is a biological illness. It needs time to, every kind of psychiatric illness needs time to get better, and there needs to be right guidance for it. So if you team up with the patient, so that is a word that that maybe we should be using more. Just team up with the patient, try to understand, be on their side, try to understand what their needs are. So asking them, what do you need at present, what are your issues, okay, how can I help you? These are better ways to reach out to a person, rather than to say, you will get better, okay, or everything will be all right. These kind of statements are sometimes really damning for the patient.
Yeah. So instead of brushing things under the carpet and saying it will get better over time, just forget about it. Say, okay, if there's a problem, let's discuss it. Let's go to a mental health professional if required. Let's go to a doctor if required, and see what treatment we can get for this. See how we can get better, so that we're not suffering with our symptoms, and so that we're also functionally very doing our best to our best potential.
So in saying that, sometimes people who are seeking, reaching out for help, and you tell them that, see a therapist or go to a doctor, they may have a sense of, like as if you're trying to abandon them, and that you're not actually wanting to help them. So it's a thin, line that you're walking. It's like, a very razor sharp edge. So what do you do at that moment, right? You can tell them again, ask them that, I also will be there with you. I will be there to support you throughout this process. And I also want to understand what's going on. But because I'm not a professional, I cannot help you the way that is required. So I will take you to a mental health professional. And as they guide me, I will behave with you. And also whatever your needs are, I will try to take care of them.
Yeah. So keeping an open mind and being non-judgmental about it really helps. Okay. Hope this helps. Thank you.
Thank you.